Good morning. Most of you know who I am. I'm Dr. Chris Haimes, and that is my gear that I wear regularly in the office every day for at least 8 to 10 hours. And I'm here today to speak as a member of our leadership, as well as part of our local medical community. I know Chad has received a lot of concerns about us not being in-person worship, and that there are several churches in the area that are. And I just wanted to say part of the reason we're not is because I'm on leadership and I've begged us to not open up. And I wanted to support Chad and staff in those decisions and let you know where we're coming from. Yes, God is bigger than all of this. And I don't think we should live in fear, and I don't live in fear. I know that inner people are hurting in isolation. I know this is really hard. I miss my church family. I miss my friends in Sunday school. But I'm really thankful for our technology. I'm thankful that we've still been able to get together. We still can hear worship. I had a particularly bad weekend where I was at the hospital literally from Saturday morning at 7:30 till Sunday afternoon at 3:30. And I was thankful that the service was taped, that I could go watch it, because otherwise I would have had nothing. So I think this is a good way for us to connect with each other, and I would strongly encourage you to do connection groups. If you are feeling isolated, that is your cry to reach out to somebody else, because you're not alone in being isolated. Many of us are, and many of us are overwhelmed, and I would encourage you to get in a connection group if you haven't already. I see people daily in the office through virtual visits and in person. I know that our depression rates, our anxiety rates are through the roof. I have more people on depression meds than I've ever had in my life. And that's saying a lot because our levels have gone up over the years. I understand the stance. I want to just trust God and live my life and not live in fear. And we should be in church because we should be worshiping God. The God I worship is not contained by these beautiful walls. The God I worship is with me wherever I go. And I take him with me. And I encourage you to as well. The thing you need to think about is people on the other side of the equation. Nobody wants to be the person that caused a car accident that killed another person, because you can't live with that. And here's what the medical community feels. All that's great. You know where you're going to go when you die, and that's wonderful. But think about the people in the community that are trying to take care of all the people that are dying. Goshen hit an all-time high on Monday. We had the most deaths we've ever had in a 24-hour period ever in the history of Goshen Hospital. In the month of November, we buried 17 people from COVID. Those are the real numbers of Goshen Hospital. We are already up to 5 this month. And if you've heard, I don't listen to the news, so I don't know what all they're saying, but Elkhart has been operating at 120% capacity for a while. I know somebody there who is an intensive care worker. And when I was in residency at Memorial, it would be a bad night if you had one code. They've had at least one code every night for months. And it's nothing. Her record was 10 codes in one night. It is nothing to have more than one person coding at the same time. And usually you only had one code team. That's not the case anymore. We now have to have more than one code team. The risk is real. The people that are working are tired emotionally, physically, and probably even spiritually. And you may have seen, if you see my stuff on Facebook, occasionally you'll hear moral injury. And what that means is that we were close to burnout before all this happened, and now we're working understaffed because we'll have maybe 50 to 100 colleagues out on quarantines or illness or what have you at any given time. The close to capacity, constant running of the hospital has caused them to call up all of our RNs that are in the offices. So we were already short-staffed, and now we've lost the RNs in the offices that they've been encouraged or required to work at the hospital now, which is not their chosen area of work, but they have to do that because of the crisis. So we hear almost a daily basis that the community says you're heroes, and we see those signs and we feel nice about that for a moment. But then what we see when we go to the grocery store is people not wearing masks. We see people who they say that they respect what we do and they care about us, but In reality, they can't even bother with wearing something over their mouth and nose for a mere 30 minutes in the grocery store. What that tells us is that you don't really care about what we're facing, or at least that's what people are perceiving in the hospital. You just need to know that. We are happy when people bring food. I know our church is participating in a process where we're bringing single serving waters and quick grab snacks for nursing and the different workers because they don't even have time to go to the bathroom. They don't have time to go get food. So I heard one colleague over the weekend say, you know, it's really nice that people want to give us food, but I don't even have time to go to the bathroom. How am I going to have time to go eat? So I just want to say, beyond just giving us food and that sort of thing, please, please try and minimize your risks because this is real. You say maybe it's just the older people that are being affected. One of my call partners who just ran a Spartan race at the end of October, got it a couple weeks into November. He was hospitalized for, I think, 7 days, and he should have been intubated at one point. He got that sick, but there were no beds in the ICU available, so he stayed up all night on a 41% FiO2 high flow system, which was very uncomfortable, and made it through, thankfully, through the night because they weren't sure what they were going to do if that didn't work for him. So our call group's down to 3 people functioning right now, so that obviously adds more stress and time. So I guess my thing is burnout is real. Exhaustion is real. Think about those caregivers who you say, I'm ready to go, but that nurse who has now been with 5 or 6 people who have died in her presence or who have died after her shift or whatever, we try and stay even keel, but it hurts us too. And I just plead that you take care of each other and reduce your risk as much as possible. Thanks.